Welcome to the BanishCancer podcast. I'm Rachel, joined by James, the cancer wellness educator. Imagine needing a doctor, but the nearest clinic is 2 hours away, buses are unreliable, and you can't afford to miss work. For millions of people, that's daily reality. But what if healthcare could come to you instead? That's the promise of telehealth. And today, we're unpacking how it's expanding access for underserved communities. James, let's start with the big picture. Why has telehealth become such a game changer in recent years?
The numbers are dramatic. During the pandemic, telehealth visits rose by more than 3,800%. Before 2020, less than 1% of outpatient visits were virtual. Now, about 22% are. That shift has opened doors for people who used to face impossible barriers: long travel times, high costs, and limited access to specialists.
And when we say underserved communities, who exactly are we talking about?
These are groups that health agencies like the CDC and HRSA define as socially and economically marginalized. That includes rural residents, elderly individuals, minorities, blue-collar workers, people with special needs, and those experiencing homelessness. They often face higher uninsured rates, fewer providers, and more chronic health issues.
And the challenges go beyond just money.
Exactly. Transportation is a huge barrier. One study found that nearly a quarter of patients missed or rescheduled visits because they couldn't get reliable rides. In rural areas, car ownership often determines whether you can even see a doctor. Add in provider shortages, with many communities lacking specialists like rheumatologists, and you see why people fall through the cracks.
So how does telehealth step in?
Telehealth eliminates distance. With a phone, tablet, or computer, patients can connect to providers without leaving home. For Native American reservations and other isolated communities, this has meant faster treatment, more consistent follow-ups, and better management of chronic diseases.
That's powerful. And it's not just rural patients who benefit.
Exactly. Older adults, people with mobility challenges, and parents juggling childcare all gain. Instead of worrying about buses, stairs, or time off work, they can log in from home. For chronic conditions like diabetes or high blood pressure, regular virtual check-ins mean better monitoring and fewer complications.
Let's talk about specialists, because that's often where underserved communities struggle most.
Right. If your local clinic doesn't have a cardiologist or mental health provider, telehealth can connect you with one across the state. During the pandemic, telehealth visits increased across nearly every specialty. And interestingly, no-show rates dropped compared to in-person visits. Some clinics even set up telehealth rooms with the necessary equipment so patients without internet at home could still connect.
And what about cost?
Telehealth saves money. One program reported saving over $24,000 in just 7 months. On average, a telehealth visit costs about half as much as an in-person visit. Patients save between $19 and $121 per appointment, often by avoiding unnecessary ER trips. For families living paycheck to paycheck, that's huge.
Government policy has played a role too.
Yes. During the pandemic, new laws expanded Medicaid coverage for telehealth in all states. Federal funds also helped bring high-speed internet to more homes and clinics. That infrastructure investment is what makes telehealth sustainable, not just a temporary fix.
I know there are some inspiring global examples too.
Definitely. In Bangladesh, the Hope Foundation used telehealth to reach nearly 500,000 patients, including refugees. In Nigeria, the Precious Gems program expanded access for rural patients and built local capacity. In Ethiopia, the Born Initiative increased stroke treatment rates and trained providers through telehealth. These stories prove that virtual care can scale across very different contexts.
Let's not forget cultural and language barriers.
Good point. 1 in 5 Americans report difficulty communicating with healthcare providers. For Asian American and Hispanic patients, the numbers are even higher. Telehealth platforms can integrate translation services more easily, helping patients feel heard and understood. That builds trust, which is critical in communities that often distrust the healthcare system.
So, looking ahead, what's next for telehealth?
Expect more mobile health clinics reaching rural areas, more remote monitoring tools for chronic conditions, and new digital platforms that lower costs while improving care. Artificial intelligence will help doctors personalize treatment and spot problems earlier. The future is about blending technology with human care to close gaps.
Let's wrap this up with the big takeaway.
Telehealth is more than a convenience. It's a lifeline. It reduces barriers, saves money, and improves outcomes. Whether you're in a rural town, a low-income neighborhood, or simply someone who struggles with transportation, telehealth brings healthcare to you.
James, thank you for breaking this down so clearly. And thank you to our listeners. This has been the BanishCancer podcast. If today's conversation helped, share it with someone who might benefit. The more we understand, the healthier we all become.